Don't go to Turkey and be a turkey. Very controversial title. I'm sorry if that's offensive. I have no racial, ethnic issues with Turkey at all. My best friends are Turkish. I've hung out with Turkish friends most of my life. I love Lahmacun. I love Imam Bayadil. I love Mante. I love all the things. I can say Nasılsın is, merhaba. I love Turkish culture. I'm going to Turkey later this year, so please don't take offense with this comment. But I really want you to know that as an ethical, passionate hair surgeon, the world has gone to hell. I read an article that's the impetus for this video. A colleague of mine posted this on our ABHRS, American Board of Hair Restoration and Surgery Diplomates page, that talked about how these TikTok influencers now are so excited about their hair transplant results and went to Turkey. These guys most likely should never have had a hair transplant. And the real problem is this article was so pro-transplant. You go, well, Dr. Lama, you're a hair transplant surgeon. Shouldn't you be pro-hair transplant? Only in those candidates that are safe. And hair transplant is not entirely safe for many people. I can spend an entire day turning away people. I can take 9 consults and say none of you should have a hair transplant. A great example, and that's another whole video about the corporate practice of medicine right now I could do as well. I saw a gentleman just yesterday, and he did not go to Turkey. He was here in Dallas, went to a chain, and it was sold by a salesman that said, look, we need to do a transplant for you right now. And the funny thing, I didn't hear that story until I was actually finished talking to him during the consult. I said, the one thing you cannot do is ever get a transplant. Whether it's FUE or strip, you are not a candidate because you have what's called diffuse and pattern alopecia, which is the back of the head was completely miniaturized, and he should not have had he should never have a transplant. And he goes, it's funny because I went down the street, met with his business salesman, and they said, you should sign up for a transplant right now. Well, he met with a salesperson. The people that go into Turkey, there are a lot of issues. First problem, you're not meeting with the doctor, you're meeting with the salesman that just wants your money. And after you go there, who knows what the conditions are? There's a room full of people that are in one room. In fact, a colleague of mine trained in doing facelifts there, spent 6 months. He said, I would never get anything there. I've seen a lot of sterility issues where people are all packed in a room. There's not the sterility types of things that are done here in terms of risk of hepatitis B, which is very prevalent over there. There's a lot of risk. But the thing I'm seeing right now, walking through my door several times a month, are overharvesting. So this video could go on for 2 hours. I mean, I don't even know how to organize it. There's so many problems. But I'm just going to try to touch upon some of them. So what is overharvesting? It's complete donor depletion on the backside, where it's all the hairs are gone. There's nothing left. And this is what you're hearing these people touting: 3,000 graft sessions, 4,000 graft sessions. And honestly, there's oftentimes not that many grafts to begin with in a person over their lifetime. And if that person is truly getting that number of grafts in a single session and they're 25 years old, what does that mean? So one is that most likely they didn't get that number. Second of all, that backside is gone. And you think about a donor strip scar that's bad, I can fix a donor strip scar. You cannot fix a completely over-harvested donor hair where the backside looks moth-eaten and mangy, like it's gone. There is no easy fix for that. You do an FUE so you can wear your hair short, but what if you have to wear your hair so long because it's so mangy and destroyed back there? You think this is something that doesn't happen? It happens all the time. I see it every week, because you're meeting with a salesperson that wants to sell you a surgery because they make a commission on it. And you should never get a transplant. He says, well, FUE is scarless. There's no problem with FUE. Absolutely false. You have white dots in the back of your head. And if you take all the hairs in the back of your head, you got nothing left. You got a completely exposed area. You can't shave your head. You're going to have an exposed area back there. Not to mention the things that I have not seen, fortunately, but I've heard about, is actually frank necrosis, where the scalp is actually destroyed. There's areas of necrosis. The scar tissue is horrible. Overharvesting I see all the time. Thank God I haven't seen the necrosis come through my door. But that is something crazy to even conceptualize for FUE. Physicians not even involved, salesmen, technicians, there's no care in the patients. The biggest thing is, instead of just bad-mouthing the quality, which is one huge part, is I want to really talk to the young guys out there that are desperate for a transplant. You should not be desperate for a transplant. Nowadays there's an option to shave your head. When you do a transplant, you take that off the table. You cannot shave your head. You don't have exit strategies on this. And so if you think, well, I'm just trying to badmouth a competitor and talk about a country and talk about not doing something, I want you to take it a step further and say, understand that I turn away patients all the time. I would rather you come in here, I just don't do anything for you. In fact, I tell my patients that come through my door that the most important thing is that we stay safe for you, because safety is the most critical thing. What is safety? Because once I go into the world of hair, I can't get out of it. I can't exit on what I'm going to do for you. That's why I don't take this job lightly. So I think about something called supply and demand. Over the long end of your life, I'm not just looking at, do you have enough hair to fix your current problem? You most likely do. And not always, but you most likely do. The problem with the economy of hair is that there's ongoing diminishment of supply because you get a bigger and bigger crown, and you get ongoing increase in demand, or it's decreased supply because I've taken through surgery. So think about this economic bad situation where you get ongoing loss of ongoing reduction in supply and ongoing increase in demand. I have to, as a surgeon, not only put you on medical therapy to help minimize things in the right candidate, but also look at you long term and say, do I have enough future supply to fix future demand? Do I have a crystal ball? Of course I don't, but I have over 20 years of judgment. So this is the thing that I want you to understand. I do my own harvesting. I use the most state-of-the-art equipment, but it's like driving a Ferrari. If you have a beautiful Ferrari and you have an idiot driving it, you're going to have an accident. For me, I'm driving the Ferrari, and it's a Ferrari. It's state-of-the-art equipment. It's done in a Joint Commission accredited surgical facility. I got state-of-the-art staff that are assisting me, but I'm doing the work. I've got people, the pit crew, that are working through making sure my grafts, that as I harvest them, are coming out of good quality, whether it's a strip or it's an FUE, and that's a whole discussion of when I do one or the other. And no, a strip is not a dinosaur procedure. It's very, very effective, and my scars are very hard to find in the vast majority of my patients, but nothing is scarless. So I'm very, very passionate about what I do. I've built a reputation of safety for my patients out there. If you're looking to get something cheap because it's there, I would highly dissuade it. Actually, I'll tell you another story. I put this in another recent video, but I think it's so worthy to repeat this, is that I recently ran a course in Fort Lauderdale where I did about 18 lectures, and I did all the components of it. And one of the course directors said, hey, one of my friends went to Turkey. He's so happy. He posted this photo of himself, and he said it's a life changer. I hear all these life-changing words, and I said, let me see this photo. I saw the photo. First of all, it's not even growth yet. It's just right after he had this done. And all I could see was a hairline that was way too straight, looked absurd, okay? Overly dense pack, which probably means his donor is depleted if those grafts even survive. And his hairline violated all the rules that I teach. I've written 9 textbooks on hair transplant, new one coming out in July. All my books go to stop human trafficking. I make no money on my books. His hairline was out here. If it goes past the lateral canthus, it's not a natural hairline. And here's the sad thing. I saw his before photographs on Facebook. They look good. He actually had a normal hairline. If I did his transplant, I'm not saying he wasn't a candidate. He looked like he was older. But his hairline shape was flawless. It just was weak. I'm sure they didn't start him on medical therapy. But that hairline was actually, maybe with a little bit of change in his frontotemporal corner, would have been fine. The other thing I want to encourage you, because you guys don't know what looks unnatural. You guys think it looks good, but it looks ridiculous. I was on a cruise a couple years ago with my wife and my parents, and I saw this gentleman that had a hair system or hair piece on and bad scars from strip scars. He had temporal angles that were weird. You go, oh, wow, I would have spotted that. Well, I asked my wife, I said, does he look natural to you? And she said, yeah, I can't even see. I can't see his hair piece. I can't see his grafts. And my wife is an incredibly bright person. She's a astrophysicist. She chose astrophysics and theoretical math because they're the two majors that she didn't have to study to graduate from. So she's no idiot. Very, very bright woman. My parents, who are very, very smart. Dad, my stepdad, a retired urologist. My mother does all the banking and everything here. They're not stupid people that have no ability to see normal things. But none of them could tell this person had something that looked weird. And his wasn't even that weird. So the problem is, even if you're excited, you go, I got a great transplant, this is life-changing. One, I don't even know how natural your results are. But two is what's going to happen in 10 years. What is going to happen in 10 years? There are no exits. I remember a guy I did about a month ago where he came in from the East Coast. It's a salvage operation. I had to do 2 small strip procedures and a beard FUE to make him halfway normal. Okay, he's not going to look 100% normal. I don't have enough donor to fix it. I remember talking to a consult for a guy out of Houston in his early 40s who's had maybe 3 to 4 transplants. I think he's had a combination of strip and FUE. And he asked me what I could do for him. And I said, I don't have a lot of options. Religiously, he couldn't do a tattoo to help it. So I really had very few options for him. And he says, I wish the doctor in my 30s, not 20s, 30s would have told me that. And I would not have been in this situation where he has no exit strategies on. Am I 100% perfect in my decision making? Absolutely not. I'm a human being, but I have a lot of judgment from having done this for many years. So I really encourage you to be safe. If you're questioning whether you should do a surgery, just don't do it. Get the consult with an ethical doctor.